We as doctors not only treat our patients, but at times we also treat our family members. And similarly, surgeons who are operating patients may have the family member suffering from the same disease. So this is one surgery where I had to operate upon one of my close relatives, and this is my perspective. This is the patient who has been seen having immature cataract in one of the eye, which was having visually significant cataract, and this was supposed to be operated upon. This is the fundus photograph, and we can see the fundus is nearly normal except for some amount of media haze because of the cataract. So the point was to operate upon with the best possible outcome. So we had planned a multifocal, a bifocal intraocular lens with surgery of phacoemulsification under topical anesthesia, and the incision was planned to neutralize the pre-existing corneal astigmatism of 0.5 diopters. So the pressures in these situations is little more than what you have in your routine patients for various reasons, because you want to take that responsibility and you have to deliver result. Moreover, if it is a family member, then you are concerned about possibility of any complication occurring which can cause further problems and not only cause issues related to the disease but also interpersonal relationships. So RXs has been performed, which is quite good, adequate in size, covering which will cover most of the part of the peripheral IOL surface. Hydrodissection has been done, and now proceeding for phacoemulsification. So this is something like grade 2 to 3 nuclear sclerosis, which is usually not an issue. It is not very soft, it is not very hard. So these kind of cataracts are amenable to good phacosurgery. So going for a direct horizontal chop, which is my preferred technique for all my phacosurgeries. And once the primary chop has been achieved, we progress on to break the nucleus into smaller pieces and also progressively emulsify the pieces as they come to the handpiece. So if you are operating upon a known person, a friend, a relative, it's a different scenario. But when you are operating upon your family members, it is little different. It is not the issue about how much payment you get about these patients, but rather the best possible outcome you want, not only for your satisfaction, but also to bear the trust of the family member. Some of us may not prefer to have a situation where you are operating upon your family member, but that's a surgeon's choice, and I have seen people who usually trust some other colleague for the same purpose. The cataract has been removed and there is just some amount of cortex left, which will be removed using irrigation aspiration cannula. When you are operating upon your friends and known people, your concern is also about the fees you can charge and also the discount you can give. And that is a double-edged sword, because not only some amount of relaxation in the fees is expected when you are operating on the patients in a private setup, but also that it also reveals the amount of margin you have if you want to operate them under cost price, which may not be a information which you would like to share with people who are known to you. But in any case, the outcome which matters gives much more responsibility to the surgeon when compared to a routine patient. So implanting the IOL now, and I have told this is a bifocal lens, and the aim is to provide emmetropia with good reading capability and neutralizing the existing zero point 0.5 diopter of astigmatism also. So I would confess that there's definitely some amount of increased stress one has when he is operating upon such a close person known to you, and rather a family member, but still it gives you that job satisfaction once the job has been completed successfully. So it's a adrenaline drive which gives you a good outcome and it gives you some pleasure. It not only is about how much good surgery you can do, but also you can consider that who else can give the kind of care you would give to your family member. So the opinions may vary, and I welcome comments from my viewers that how do they take up these situations where you have to have a disease which is your specialty, and then what do you decide to do, whether you operate them yourself or whether you ask one of your capable colleagues to take up. The surgery has been finished and hydrating the wound and sealing the anterior chamber. Just to be sure, I wanted to hydrate this portion of the wound also. Surgery is finished. Now this is the day 1 picture which reveals good picture and is 6:12 vision unaided with pupil which is slightly dilated. This is another photograph on the day 1, and we can appreciate the rings of the diffractive IOL in place. And now when the patient was seen at week 1, that is day 7, the patient has vision of 6/6 and N6 unaided, and this is the kind of result you strive for. Thank you.